My name is Crystal O'Loughlin from Angel Aid. I am so honored to present or hand the reins over to Randy Phelps. Randy is the leader of an organization called Give an Hour. Give an Hour has just been on the Angel Aid radar for many, many months. We've established a partnership. The intention of Give an Hour is to match up mental health resources with those in our community that may want to take advantage of them. And they've proved out this model in military and veterans caregiving and other caregiving communities. And so I'm sure Randy will talk to you about that. But for today, we really just wanted to honor May Mental Health Awareness Month and give us a chance, all of us, to just check in on how to pay attention to our own mental health. So I'm going to hand it over to Randy and just say thank you
Thank, yeah,
in advance
thank you,
for
Crystal.
giving him.
I appreciate it, and of course, naturally, the internet's breaking up a little bit, but we'll get there. So I appreciate the opportunity to do this and to try to get started with Angel Aid Cares in terms of this partnership that Crystal has talked about. And so I will share with you, I'm running a whole bunch of panels and talks and so forth through the whole month. May is Mental Health Month, and through our Week to Change Direction activities, and so on and so forth. And so when I do panels, I typically ask the people on the panel, why are you passionate about this? What are you doing here? And why are you passionate about this topic? And I thought that would be a good place to start with this group. The reason I'm passionate about mental health, but also about the issue of rare diseases and terminal illnesses, and that whole part of the world, is that my younger brother at 29 years old died a horrible death due to amyotrophic lateral sclerosis. And his 2-year losing battle with ALS devastated the entire family. Now, this was many years ago, but my father never recovered from the trauma of all of that. And frankly, my mom didn't either. But a few years after, my father took his own life. And those two things have been seminal events in my life and propelled me to become a clinical psychologist 40 years ago. Now, you say 40 years. Now, wait a second. You must have been 12 when you went to school, right? Just kidding. But I have been a psychologist for 40 years. And I have achieved a lot of what I have set out to do for myself in terms of increasing access to mental health services for lots and lots of people. I've had the privilege of working nationally for the last 25 plus years in mental health here in Washington, D.C. But I've never been able to connect until I connected with Crystal. My desire to help folks who are struggling with the same kinds of rare diseases and what it does to individuals and their families and their individual mental health. So this is a big deal for me to be here and start this conversation with folks. Now, Crystal said, a bunch of stuff about Give an Hour, and I'm going to trip through that and show you some of the things about the journey that we've gone through, my wife and me, who is also a clinical psychologist, and who actually started Give an Hour herself out of her basement 16 years ago now. But I want to end up with a model, and that's the most important part of this, a very simplistic model about how to think about your mental health, how to pay attention to it, and what to do about it. I want to try to wrap all that stuff up, not, do the chalk talk slideshow stuff for an hour or any of that. I want to get through that so we can talk and do Q&A and discussion. And I just realized that I started to say, Paige, give me the next slide. But wait a minute, I got it. So let me start out with mental health in the United States. It's something I'm really familiar with over the last 25 years. Did you know, you may know that prior to COVID, for many, many years, at any given time, 20% of the population has a diagnosable mental health condition. Those are government figures, and it's just been solid as a rock for a very, very, very long time. That means 5 people in a room, one of those people likely has a diagnosable mental health disorder. Now, that's what was going on before COVID. Those of us in mental health at the outset of COVID said, oh my God, we know what happens to mental health as a result of natural disasters and man-made disasters as well. Things are going to get a lot worse. People are going to be those with pre-existing conditions, going to have a lot more difficulty, but it's also going to create whole new cohorts of people. So I'm here to tell you that the latest data from CDC shows that approximately 40% of Americans are now struggling with anxiety, depression, substance misuse, or combinations thereof. That's double. Those 5 people, your good friends, standing there, 2 of them now are dealing with mental health issues. And frankly, all of us are dealing with the emotional effects of a year's worth of, as I call it, being in our caves. And so I'm going to talk about coming out of your cave in a little bit. But so the issue of mental health is a big one for all of us all the time. It is much worse for the country and frankly the world as a result of this COVID. Now add on top of that, some populations are way more at risk by virtue of the work or the role that they play. So that first responders, the nurses in emergency rooms with COVID, and dare I say, moms of people with rare diseases, and families like mine dealing with ALS. So we're all at high risk, right? And that's why we need to start out with knowing our risk factors and doing something about it to take care of ourselves and our loved ones. So let me see, what do we have here? I'm not going to go through all of this, but this is Given Hour. Again, we've been around 15, 16 years now. And 5 years ago, we broadened our focus from free mental health services to veterans and returning troops and their families. We broadened it to public health of the entire population in the US. Our goal is to try to bring a focus on positive mental health, emotional well-being to everybody in the culture. And so we do so many things across different arenas. I'm going to tell you a little bit about the 3 pillars of our work to improve mental health, and not dwell much on them, but just get down to this mental health literacy or education one. So the first pillar is access to mental health care. We started with, again, the veterans population, and we still do that. And give you an indication of our success, we have 4,500 licensed mental health providers who volunteer an hour a week for a year to give free treatment to somebody in need. We have crossed, we're about to cross another one, but we have given 340,000 hours of free treatment to military vets. And so that's sort of our legacy business. Now, when COVID hit a year ago, I said to our staff and the board, so, sort of what I said to you guys a while ago. Look, we know what's going to happen. We saw what happened with Katrina. We know what happens with the wildfires in California. We know what happened to the mental health of the population with the Asian tsunami. This is going to be hell going forward. Let's see if we can help using the model we know, treating heroes for PTSD. Let's do that for folks that are hospital workers, frontline, but let's also start doing a lot of education. And I'll show you some of that in a bit. So, so we now have a program with frontline hospital workers that I'm trying to extend. It's in New York, New Jersey, and Connecticut, ground zero. I'm trying to extend it to the whole country, but I don't have funding at this point. And then we do natural disasters and man-made traumas. And so we roll when Las Vegas killings, you name it, Parkland, all that stuff. The second pillar is the one we started 5 years ago when we said, look, we had to change the culture of mental health. Nobody talks about their mental health. You know, they talk about, gee whiz, my dad was in the hospital recently, Crystal says. Oh yeah, what was that? And the conversation goes on and nobody thinks anything about it. How you doing? Severely depressed, have been suicidal lately. I don't know what to do. No, nobody says stuff like that. And we realized that the service members didn't come back from 9/11 wars and walk in and say, raise their hand and say, I'm having PTSD. Somebody help me here. We just do not deal with our emotional issues in mental health because of stigma, shame, all that stuff. So my wife said to me, one of her small ideas, I think we need to change the culture in the US so people are more likely to talk about this. And I'm like, how soon do we start, honey? So her name is Barbara Van Dalen. She's a clinical psychologist, and some years ago, Time Magazine named her one of the 100 most influential people in the world for her leadership in this arena and starting Give an Hour for the Troops 16 years ago. So culture change, this one's a big one. So we do all kinds of stuff. And basically what we're trying to do is help people understand your emotional well-being is as important as your physical well-being. You need to treat them both with care equally. So we've used a lot of sort of tricks, get celebrities. This is one of Brian Wilson, the Beach Boys, always kills me, and his wife. And that's my wife, Barbara Van Dalen, on the left. And they're talking about the 5 signs of suffering, which is a model that I'm going to show you in a bit, to keep track of yours and your loved ones' emotional well-being. Probably recognize the former First Lady and now the current First Lady, Joe Biden. Prince Harry has done PSAs for us. Paul Dano is a guy that played Brian Wilson in the movie about Brian's life. And I don't know if any of you guys are Million Little Things fans, but down the left-hand corner is DJ Nash, who's the writer and the guy who started Million. He's a showrunner basically out there, and Little Theo is one of the actors. The Million Little Things is a ABC thing about friends, and one of their buddies took his own life, and then the aftermath. And that happened to a friend of DJ's, because he's a comedian writer, a comic writer. At any rate, they did a 5 signs run for us and all kinds of stuff. So the power of celebrities help people understand it's okay to think about these things. We've done summits, London, Los Angeles. We did New York last year, right, before the pandemic hit. And then next week, so Angel Aid Cares is a part of this. Next week, May 10th through the 16th, we're doing our global week to change direction. And the notion there is get everybody you know to go online and to do things in their communities and or online communities to just elevate the profile of mental health. And we've got a lot of folks involved. Last year we had 32 countries and, you know, a lot of folks. So I urge you to go to giveanhour, all one word, .org and register and take a look at how you can help out. Now, let's go to pillar 3. So this is, okay, let's bring it down to people. Beyond culture, which is people, let's bring it down to people. And we need to help people understand simple ways to learn about and be aware of their emotional well-being. We're both psychologists. We started thinking about what are the signs that let you know that somebody is in emotional pain. You know, if I fall over right now, and you can somehow with this camera see me holding my chest and my left arm is down and complaining of terrible pain, everybody on this call is going to know exactly what's happening, right? And you're going to know, call 911 and say, we got a cardiac arrest going here. Most people even know now what a stroke looks like and what to do. But we reasoned, does anybody know how to spot when somebody is in great distress, especially those of us who are really good at keeping it inside? And so that's where the 5 signs were born. And here they are. The 5 signs of emotional suffering, and the Given Hour initiative that this falls under is the campaign to change direction. And so what I'm showing you is, you see these little cards? These are all over the country now, branded by our partners, Aetna, VFW. One of the ones that I love is when we're working with the folks in the UK. This one's from the Department of Defense in the UK that they gave to all the military folks there. What are the 5 signs? So these are based on actual symptomatology. There are about 18 signs we use in the mental health field to diagnose, but these are things that are very important, and more important, they're things that we all know out of our humanity. We've all felt sad, maybe hopeless at one time or another. We've all been angry. We've all been agitated. But when you begin to see clusters of these things in yourself or in your loved ones or colleagues or whatever, they're signals that something is going on. And you should, inquire. And we can talk about that in a bit. So let me unpack them a little bit. Whoops. Figure out how to do this. Okay, so personality change. This is a powerful one. And have you ever said, gosh, he doesn't seem like himself anymore? I don't know what's going on with this guy. I'm having that experience right now with one of my best friends. I'm like, Daryl, something's not right here. You just don't even seem like yourself. Personality change is a powerful and important sign. The next one is agitation. Now, this can be, and it's uncharacteristic. I and my younger stepdaughter tend to run anxious. It's so priceless. When this kid said to us at 12 years old when we were doing this work, she said, I think I run anxious. Pretty good, kid. So agitation is somebody who walks around angry all the time or anxious, moody, agitated. Third one is withdrawal. And this one is important to distinguish from your baseline. Some people, there are a lot of people that are introverts, and so they tend to be withdrawn and very comfortable with that. This, in that person, somebody who's even more withdrawn or isolated, that's the danger signal there. Taking care of yourself. In the most extreme form, this is really dramatic. The person stops taking showers, paying attention to any kind of physical care. But it can be as subtle as, I notice they're drinking more. I notice they're just not quite as careful with their physical appearance. These are indications the person inside is just not focused enough on good care of themselves. And then finally, hopelessness. This one is a danger signal. Hopelessness is very much a part of suicidal thinking. It doesn't always lead to that, but you're better off to think about it if you see hopelessness in somebody. And this whole thing about if you ask somebody, are they feeling suicidal, that you're going to trigger it, that is absolute hogwash. It's not at all the case, and it is something to do. So those signs in combination or really repetitive or powerful in one of those arenas is important. I'm going to switch over because I want us to be able to talk. But the healthy habits is the other side of the card. And these are things to do to care for yourself, to prevent things from getting bad in the emotional realm. So they're definitely prevention. And they're, in many cases, they are intervention that prevents things from going forward. So they're really straightforward. Take care. This is the one that has to do with your physical, the things we all know to do: sleep well, get exercise, eat well. Easy to say, and not always easy to do. But that's what the take care of you is be focused around those basics. The next one is check in and check up. And so that is check in with your friends. Do I seem different to you? Do I seem like myself to you? And this goes all the way to, I am really concerned about you, and maybe you should go talk to the family doc about you're constantly tearful and depressed and all of that, or maybe I can help you see a therapist. So that's the check-in. Don't be afraid to do that. This one is incredibly important. Engage and connect wisely. What this one is relationships. We cannot be emotionally healthy if our relationships are not emotionally healthy. So paying attention and doing what you need to do on relationships in your life is absolutely essential to your well-being emotionally. The other is learn, fourth sign is learn ways that work for you, and it's different strokes for different folks, as we know, to trip the wire and move into relaxation when you need to. People do everything from meditation is a wonderful one, of course, for a lot of people, but, read books, whatever. Learn to cook, etc. But finding out what works for you to bring your psychology and your physiology down. And then the fifth is know the 5 signs. And so that you can take an occasional appraisal of yourself. How am I doing on those things? So what we say, this is an interesting, this picture is, I can't see him because it's covered up, but I don't know if you guys know who Chris Stapleton is. So Chris and his wife are in the middle of this picture that we did at the old soldiers' home a few years ago, and then Chris did a concert for Given Hour here at the Constitution Center. Anyway. So everybody's doing, do you know the 5 signs in this? So what we're saying is practice the healthy habits for yourself. Watch for the signs in yourself and others. Reach out to people. Don't be afraid to reach out to your loved ones and say, I don't know anything about this emotional health stuff, but I care about you and I'm concerned, and I will help you find out if there's any way that you can feel better. I said we did a lot of stuff, educational things during COVID. So we have I'm just actually was editing earlier today another what I call coming out of the cave. What to do now that COVID is beginning to wane. Fact sheets, and so we have them on loss and talking to your kids and emotional well-being, et cetera. They're all at givenhour.org. And finally, we are talking with Crystal and Angel Aid Cares about piloting our emotional life skills training, which just packages all of this into like a 2-hour online group, or could be in person, where we teach people about early identification, self-care, and most important, support systems. And that is a place to stop, because Angel Aid Cares is an incredibly important support system. And I'd like to have a conversation about that and the other things that we've said, or I've said so far. If you want to reach me, there's my email address, rphelps@givenhour.org. So over to, I think Paige is the moderator, right? Over to Paige.
Yeah. So if anyone has any questions that they feel comfortable asking, you can either put them in the chat directly to me and I can ask it and I won't say who it is, or you can just put it in the chat, or unmute yourself. Otherwise, I have a few questions that I hope are questions that you're thinking all, but maybe don't want to say. So I'll start with one of my questions and give you guys a minute to maybe think about it. So Randy, you were talking about the 5 signs, and then you mentioned that there's actually like a plethora more. And I heard you say briefly, like one of these in a very serious fashion or all of them together. Do they show up together often? Or if we just notice one of these things, is that something to be fearful of? Or do you just associate that to like, oh, maybe they're just dealing with this one thing and it'll pass?
It's a great question. What you don't want to do, I mean, just like with physical disorders, one symptom that's obvious, that doesn't mean there aren't silent symptoms and all of that. But you're less likely, unless it's very serious, and that's where I was introducing the notion of hopelessness. If somebody's talking in a way that is hopeless, doesn't see a future, I don't care what other signs there are. You need to reach out to that person. Period. And I know I was taught early in my career, 40 years, be careful and all that. And that the research shows that is absolutely insane to do that. Many survivors of suicide will tell you, suicidal planning and potential attempts. I didn't go through with it because somebody asked me on the bridge, how was I doing? Just a how's your day? And that's what I needed. So that one aside, but I typically think of this as sort of a constellation, 2 or 3 things, Paige. Just like I said, again, the signs of a heart attack, some guy sitting there, and kind of falls in his soup and that's about it. You might not know what's going on, but if he's like chest pain, left arm, all of that. So these are just guidelines. The reason I said there's probably 18 or more is from debates with friends in mental health, psychiatrists, psychologists, whatever. Well, the American Psychiatric recognizes 18 different things that we use to make differential diagnosis. And that's, that's fine. That's the inside the business, and that's their job. This is not teaching the average American to be a diagnostician. We don't want to do that. You're not trained. We want people to reach out to each other to begin talking about pain and to help each other. And that's what it's about. Because the most powerful, I will say this and stake my reputation, in 40 years as a psychologist, doing research, lots and lots of treatment, national public policy, et cetera, the thing that I can tell you that works powerfully with emotional health and mental health disorders. Sometimes it's medicine. Sometimes it's talk therapy. Sometimes it's combination of medicine and talk therapy. If you don't have social support with all of that stuff, you don't have enough. Social support, we've known this for 50, 60 years, is one of the most powerful variables to help people deal with these kinds of issues. And, you know, AA got it 100 years ago, and then we've gone forward, and now we have peer programs, peer support programs for lots of things in mental health, but also in physical health, obviously. And it is just a critical ingredient. So I'm all about building support systems. And when we do our emotional life skills training, we say, you know, you people may not know each other, but you do now, and you're a support system now. So go forth, look out for each other. Anyway, I have, you know, you're asking me questions, Paige, that's bringing out the college teacher in me. So sorry for the lectures. Other questions?
Yeah, there's Crystal asked in the chat, can you coach us on how to start a conversation with somebody who you think needs help, especially without putting them on the defensive?
Yeah. And especially without putting them on the defensive is the one I can't help you with, because if somebody is not ready, they are going to be on the defensive. So you have to assume that the person is going to be on the defensive. And so you have to assume that that's a process, that this isn't one conversation or two or whatever. But and so that's the important thing. Think about it as a process, not a one-shot deal. And I like to talk about this in sort of what you can do right and what you can do wrong. So what you can do wrong is take the position sort of that I know more than you about what's good for you. That, and whether you do or not is irrelevant, because that guaranteed is going to bring up defensiveness in that person. Better to shift to the other side, which is empathy. And if we have a deal that we use in the emotional life skills. It's a little tape thing by Brene Brown, who's a social worker in Houston. It's really brilliant. It's sympathy versus empathy. So the not do is the sympathy. God, it must be terrible. You know, you'd feel so much better if you did this, etc. I really understand. I've been there before. That's sympathy. That creates the wrong feeling in that other person. Empathy is the other side, your ability to put yourself in their shoes. Look, I don't know what it's like, but I'm watching you and it tears me apart. I hate to see this happening. I don't know how to help, but let's try to find some help. Is there anything I can do? So it's the, you know, walk a mile in my moccasins versus, wait a minute, tie those moccasins. Let's get something fixed up here. Now, that's sort of black and white, but I think it illustrates the sort of where you might want to go. And you know, in some of our training, we say, look, take the shot and see where it goes. And because you may walk away going, that didn't go the way I wanted it to go. And that is information for the next time, isn't it?
Yeah, thank you.
Yeah.
So we have another question. What strategies can we use to help caregivers allow themselves to be supported when they have been let down so many times and have always had to carry the burden alone?
Oh, that's
Randy, I'm just thinking about, like, how do you make them, you have that one shot, right? it's like, what do you do? It kind of feeds into what Crystal was saying about starting the conversation. But it's like, we're not gonna, what if we don't get another chance? It's like these folks have such trust issues sometimes because they've always been let down and there's never been hope for them. So it's like, why start now?
Absolutely. I hate to make this sound so negative, but that's a longer term project, as I said, so that I don't know who was speaking, Allison or
Sorry, yes, it's Allie.
So Allie, let me answer you this way. When my dad took his life, after my brother lost his life, wasted away right in front of us 2 years. I was a young clinical psychologist, and I actually was living on the other side of the country and didn't even know my dad was showing symptoms. And I've said many times, if we had the 5 signs, somebody would have stepped in back then. But do you know, I'm a licensed clinical psychologist, very successful practice in Houston, yada, 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 yada. I never spoke about my brother's illness or my dad's suicide for 30 years. Never spoke about it. And my wife said when we were starting the change direction 5 years ago or whatever, she goes, you know what? We're going to have to be role models. I am going to talk about my mother being homeless and schizophrenic. And I've never talked about it. And you know what I said to her? Look, I'm the tough guy, right? I go, if you think I'm talking about my dad's suicide, you're crazy as hell. Not a chance. And because I couldn't let it down, because I was the guy taking care of everybody in the family after that. And I was the guy taking care of everybody else's family in my practice, et cetera, et cetera. I will say the good news, I hope your colleagues are not this kind of a 30-year project, because it doesn't take that long. But I will say within 3 months of actually saying that, the ability to say, if you think I'm going to share this with other people, and actually say it instead of think it, within 3 months, I was telling a story in speeches. And the number of people that come up to you and say, incredible, same thing happened to me, nobody's ever said, you've given me permission to talk about it. So it's a long-winded response, Allie, but just don't let yourself think about it as the one-shot deal. If it is a one-shot deal, get in there and be your empathetic self, but don't overdo it. And then you can't save everybody. That's the other.
Allison, I'm so glad that you brought that up. And Randy, you're right. It's a process. And I think my experience has been to just keep showing up and keep asking the question and just doing it with loving intent. I care, I'm here, and I'm going to keep asking you because I care and I'm here. Absolutely. And that's kind of, doesn't solve everything, but I'm so happy that we're having this conversation. There's chats like direct message chats flying back and forth. Randy, you're really striking a chord with people. So keep going with our questions page. What's our next one?
Yeah, that's good. Let me say one. Let me tie some things together though, Crystal. Think about the 5 signs as well. Now the 5 signs are a little yardstick to try to get a sense of where that person is. And with all of us, they wax and wane. The first thing on our coming out of the cave fact sheet is take stock of yourself and sort of go through and, what emotional things you've been through in this past year and what's still stuck with you. But even in that situation with this other person, and you have to be careful so you don't kick up the defensiveness. But one time, next time, Crystal shows up again, you can begin to say things like, I noticed that seems like you're angry all the time. and I don't know how to talk with you when you are. And I don't want to abandon you. And this is a scenario that's happened between me and Barbara. That's my wife. What do you mean angry, damn it? I'm not angry. And that's what you're going to get from the guys. So, well, if you weren't, why are you cursing? And why is the decibel level up there? So you want to be careful about that, because then you could shame somebody, and you don't want to shame. But the 5 signs gives you data on where a person is. Don't go after the most vulnerable, but there are other ways in. Does that make sense? Okay.
Yeah, thank you.
I have a
Go
question
ahead.
I'd be happy to ask. Randy, this has been really helpful. I just love the whole topic, and this is just wonderful.
Thank
One
you.
of the questions, I like what you had said about, I listened to, I can't remember his name right now, but the pretty well-known guy who jumped off the bridge, San Francisco Golden
Yeah.
Gate, and survived, talked
Yeah.
about how
Yeah,
if someone would have just asked him,
absolutely.
are you okay? So I think that's a big one. But I volunteer for a helpline. And one of the things that we've really learned is that it's okay to ask if someone is feeling suicidal. That's not going to give them the idea.
Right.
So I've gotten comfortable with that. But one thing that I found is tough is if there is the suggestion of one of our resources to see a therapist, talk to a counselor. With some people, there's an immediate pushback because they think they should pull up their bootstraps and be tougher than that.
Yep.
I like how you list the healthy habits and the different things about taking care and checking in and socializing, that kind of thing. Are there suggestions if you get that kind of pushback that maybe somebody has, they're against therapy or counselors, and they want a different direction? Is there still that encouragement of, what about joining a sports team or going for a walk each day? Or do you have suggestions on that?
Yeah, a couple of things. And it helps if you have a sense of, what I call baselines, and you can just ask the person, are you somebody that, throughout most of your life, you like to spend time by yourself? Or you have to be around people and stuff, because that will help you gauge suggestions. But Carrie, come back to this thing that I was saying a while ago. What is the most powerful thing we have at our fingertips? You guys can't write prescriptions for antidepressants. I can't either as a psychologist. You guys can't get somebody into psychotherapy. I can, because I'm licensed to do that. But what we can all do is we can use the power of support systems. And so with that individual, and that doesn't mean it's over then. That if you can help that person overcome the barriers to get into some kind of a support system, they then take over. Somebody there says, I really care about you, but God Almighty, when I was like you, miserable all the time, I got medicine that helped, or I saw this psychotherapist and she's amazing. So if you think about, sending them into some kind of support system like Angel Aid Cares, where people are talking to each other and all of that, in support groups and sharing, that's one way. But for somebody who is more individual, your point about going after, do you do walks? Do you do exercise? What do you do? It's back to that number one, the one about relax, the 4th sign. What do you do that actually works for you? Well, nothing works, nothing. It used to, but nothing works. Well, let's try to find something together that might, are you willing to try at least? And so just think, support is a powerful muscle. Don't be afraid to flex it.
Thank you.
Yeah.
I like that last part, the powerful muscle.
Yeah.
That's a nice way to think about it. I think we probably have time for at least one more question. Unless anyone has one, I have one that I'll ask. I was talking to some moms the other day about the sense of guilt that they have just about any time they take any time for themselves or anytime they think about themselves. So how do you talk to somebody about taking care of their mental health when they feel this like anxiety and guilt surrounding taking care of themselves? How do you address that?
Yeah, it's really tricky. So it's it's easy for me to sort of flip off metaphors that I used to use pretty routinely in family therapy, I would say, and I'll go with you on moms, since this is a group of moms. Mom, I wonder why they say on the airline, when that thing pops down with the oxygen, you need to put it on first. Aren't you supposed to put it on your kid first? And they go, oh, yeah. So that is a very simple metaphor for how the hell can you do your job day and night to be a caregiver with that person if you're half dead, if you're constantly fearful of taking 5 minutes for yourself to even catch your breath. You can't do the job that needs to be done, or you can do it for a period of time until you finally fall over with illness and fatigue and exhaustion. And so all we're trying to do is just get a little foot in that door to get somebody to think differently, and you can help somebody who thinks that it's gone on for so long that their entire image and sense of self is only as the caregiver of this child with this horrific disease. That is the only thing that they've got going. If you can get a little wedge in there and help them understand that they can even do that job longer and better if they care for themselves. But that one is really hard. It's really hard. We're talking life and death stuff here. But you should do it anyway, because if you're not around, that baby is not going to survive.
Yeah. I think that's definitely tough to switch your mindset.
Oh, absolutely.
Like that.
Listen, especially for moms and female caregivers. I was just looking at some data that, of all people, CVS, Aetna, and Aetna is a partner of ours, just came out with, and they're going to share this during the week to change direction. And in one of the webinars I'm doing with Cara McNulty, who's the president of Aetna Behavioral Health, and they're the guys that have funded us on the Hospital Heroes program and stuff like that. And they just did this data collection and found that it's something we've all seen in the newspaper. Women have fared worse than men in the year. And why is that? Geez, the guys all went, oh gosh, let me drop everything in my career and take care of these kids and be the school teacher, et cetera. Right? That happened everywhere. And then the women had no idea what to do with themselves. And so they all were upset. Bull. It's the other way around. And so caregiving is something that our culture is sort of forced as a gender-based deal. And fortunately that's changing some, but not enough. But the data were terrible for the psychological sense of well-being for moms and caregivers, and especially mom caregivers. So, like 66% showing, severe effects of stress and anxiety. So this is, sometimes I joke around, as you can tell, because this stuff gets, pretty deadly talking about it and thinking about it in people's lives. But it is really serious. And why we all think that, we got to spend so much energy on, I got to get to the gym, or I got to run on the treadmill because, COVID, and I've got to eat right. I've got to do all this stuff, which is wonderful. But we're going to neglect the other part of us, which is our emotional well-being. If you don't have your emotional well-being, believe you me, you will not have your physical well-being. It works that way.
Yeah. And I might just add, Randy, because it's the number one thing we hear from mothers, from caregivers, from rare mothers,
Yep.
from women, from everyone, is I don't have time.
Yeah.
I don't have time for self-care. And so I just encourage anyone who's listening to remember it's just small little micro changes.
Yep.
Just
Yep.
just an awareness, give yourself the grace of the benefit of the doubt, and just make a small little change each day. It doesn't have to be these big,
Absolutely. Absolutely. Do you have 5 minutes to do deep breathing? Do you have 10 minutes to do meditation? Come on, you can do that once a day, right? Yeah. You got to get a foot in the door. Change is hard. I don't care what kind of change it is. Change is hard.
Yeah, but once you get that momentum going, the
Absolutely.
change starts to happen. So
Absolutely. And if you have any kind of a support system, just one person, and it can be somebody pretty remote, that will help you.
Well, I love that you're bringing up support systems because that's what we're all about at Blade. That's perfect timing. We're at the top of the hour. So I'll just remind our community that we gather weekly every Tuesday at 10 a.m. Pacific Standard Time and every Thursday at 11 a.m. Pacific Standard Time. So you can go to angelaidcares.org, click on events. You can see our retreats. You can see our weekly get-togethers. You can see our monthly get-togethers. We are here. The resources are listed also on our resources page. I'm so grateful to you, Randy. What an amazing, amazing day. Thank you.
Thank you. Thanks for the honor and the privilege.